3 సంవత్సరాల ముందు ఇది వచ్చింది. వస్తే కూడా ఒక నెల రోజులు తిప్పబడా నాకు తెలియలేదు. వెనకసిరికి పోగానే ఏమన్నా నీకు అస్తమా వచ్చింది, ఎలాడుతుంది, దమ్ము తార్నాక పోయినా, ప్రైవేట్ ఇచ్చిపోయి తార్నాక పోయినా మా హాస్పిటల్కి పోయి ఆ గోళీలు తీసుకున్నా. 15 రోజులు తార్నాకలో ఉన్నా, ట్రీట్మెంట్ అయిందని ఇస్తే పంపిస్తే వచ్చిన ఒక నెల ఉన్నానుకో తక్కువ ఉంటుంది, మళ్ళీ ఎక్కువైపోయింది. తార్నాక మళ్ళీ ఒకసారి పోయి తెచ్చుకున్న గోళీలు అవే. సెకండ్ టైంలో కూడా, థర్డ్ టైంలో పోలేకపోయినా ప్రైవేట్లో చూపించుకున్నాను. నా ఆరోగ్యం బాగాలేక అట్లా చూపించుకుంటే మనగా చేప మందు కూడా మింగేసిన. ఆయుర్వేదిక్ మందు వస్తారంటే పైసలు ఇచ్చి అది కూడా తాగేసిన ప్రైవేట్లో. దాని తర్వాత అన్నిటికీ పెట్టి ఈ గోళీలు చేసుకుంటే ఇంతవరకు కాలం పడినా. ఇప్పుడు ఏమైందంటే ఏకదమ్గా మన నెల వచ్చినందుకు నా బాధ నాకు చెప్పలేక తీరుతున్నది. ఇప్పుడు నేను ఏం చేయాలని మీరు వచ్చినందుకు మీకు చెప్తున్నాను నా బాధల మొత్తం. దీనికి ఎలాంటి ఇదైనా నాకు తక్కువ చేసే ప్రయత్నం చేయండి. అది దేవుని గారికా ఇక డాక్టర్ గారు కాదు, నేనైతే ఏం చేయాలి. ఇంకా
أشهد أن لا إله إلا الله.
ఎలా ఉన్నది చెప్పండి.
ఇప్పుడైతే మా ఆరోగ్యం చాలా పరిస్థితి బాగాలేదు.
ఆయాసం ఉందని నాకు తెలిసింది. దాని గురించి మీకు ఆయాసం ఉంది కదా, ఇలా ఓపెన్ గా ఉండాలి మొత్తం. ఓకే, గాలి ఇక్కడ నుంచి హాయిగా పిలుస్తావు, హాయిగా వదులుతావు అనమాట. ఓకే, ఇది నార్మల్ మనిషికి ఉండేది. కానీ నీ ఊపిరితిత్తులు ఏమైందంటే లోపల గాలి పీల్చుకునే భాగం, వదిలే భాగం, అది ఏమైందంటే మొత్తము ఇక్కడ దగ్గరకు వచ్చేసినాయి మొత్తం. తర్వాత ఇలా అయిపోయినాయి మొత్తం. ఇలా అయినప్పుడు ఏమవుతుంది, గాలి పీల్చుకోవడం కష్టం అవుతుంది. సో నీ డాక్టర్ దగ్గర వెళ్ళినప్పుడు నువ్వు వాళ్ళకి అడుగు, సార్ ఇది మాటకు వస్తుంది, నాకు కంట్రోలర్ మెడిసిన్ ఇవ్వమని చెప్పు. కంట్రోలర్ అంటే మళ్ళీ మళ్ళీ ఆయాసం ఉండడానికి వద్దు, నాకు ఇది పీల్చుకోవాలి. ఇది ఏది తెల్లపాటు దీంట్లో ఉండాలి. బాగా వచ్చేసి ప్రెస్ చేసి కట్ చేయాలి. రైట్, ఇప్పుడు ఏం చేయాలి, గాలి బయటికి వదలాలి. ఇప్పుడు నేను చూపిస్తాను చూడు. ఓకే, పెట్టుకున్నా.
I think the concept of late onset asthma, or what we call adult onset asthma, we are just beginning to understand. We are now recognizing other risk factors which can increase the risk of a person getting asthma. For example, in the presence of air pollution, the allergens or the effect of the allergens actually gets amplified, and therefore it can increase the risk of asthma.
Environmental pollution is definitely emerging as a key player. Compounds of sulfur, there are compounds of nitrogen, there are toxic oxygen radicals, so many things are there, and the particulate matters, which are very, very important as well. So these affect the lungs with different mechanisms, but the end result is that they destroy the function of the windpipes, the airways. If you treat asthma late, the results may not be very rewarding, because the windpipes may themselves have undergone structural changes, which we call in medical parlance as airway remodeling. And once the airways are remodeled, once they have been constricted by surrounding unyielding tissue, it becomes very difficult for them to expand back to their normal innate state.
ভয়ানকই, মানে রাত্রির বেলার যে মানে রাত কাটানোর যেটা ব্যাপার থাকে, যে ঘড়ির টিকটিক শুনে রাত্রির 10টা থেকে সকাল 5টা 6টা, ভোরের দিকে একটু কমে যায়, রাত্রির বেলা বাড়ে, তো তখন মনে হতো যেন সকালটা কখন হবে, একটু তো রিলিফ পাবো। এই বাচ্চাদের কোনো এঁটো দেবে না, বা কোনো বাচ্চার সাথে মানে খেলতে খেলতে ও খেতে খেতে কিছু খাবার দিয়ে দেবে না, তারপরে এটা করবে না সেটা করবে না, এক জিনিস ইউজ করবে না, একটু আলাদা করো, কারণ এটার থেকে এটা তোমার ছোঁয়াচে হতে পারে, এই হতে পারে সেই হতে পারে। তারপরে যখন বিয়ে হয় তখন ওই একই ব্যাপার, যখন বৌদি জানতে পারলো তখন ওই একই যেটা হয়, আমি তো আলাদা সব কিছু ইউজ করতাম, তার মধ্যে আরও বেশি করে, মানে যেটা এটা আরোই ধরবে না, ওটা ধরবে না, আমার এই জিনিসটা নেবে না, আমার চাদর গায়ে দেবে না। বিয়ের কথা ভাবছি না, মানে কেউ বাড়ি থেকে বলল আমার এই প্রবলেমটার জন্য, আমি ভাবি যে হয়তো হয় না, যেটা হয়তো শ্বশুর বাড়ি গিয়ে কতটা নিয়ে নিতে পারে আমার, হ্যাঁ এটা আমার ভয় তো আছেই, যে করবে না হয়তো, বা আমাকে দুদিন পরে হয়তো পরে শোনাবে কোনো কথা, বা হয়তো সংসার যেটা হয় ভালো লাইফ, তো সেটা না থেকে হয়তো প্রবলেম হতে পারে।
The term asthma also has caused a lot of social discrimination, and it continues to do so. In fact, girls of marriageable age, if they are told they have asthma, they would not like to reveal it to their would-be husbands, because they feel that that's when a marriage would not take place. Perhaps if we get rid of those, then we will start using the word asthma more freely. Like today we use the word diabetes.
The mainstay of treatment of asthma and COPD is inhaled therapy. The advantage of inhalers is that it's a medication which is given directly to the lungs. If you have a medication which can be given directly to the organ which is involved, you can have an onset of action which is very rapid. You can give a much lower dose and you will have no systemic side effects. And that is the advantage of inhalers. The onset of action is within a few minutes. Person who has asthma, who takes inhaler, he immediately gets relief. The action is causing no systemic side effects. If you take a tablet, some of these patients are having tremors, their hands start trembling, their heart rate goes up. That doesn't happen with inhalers. And secondly, the dose that is required, because it's going directly to the lungs, is much less. The inhalers, you talk of dose in micrograms. The same tablet is in milligrams. So dose is really different. The problem is that there is a lot of resistance among patients, and I think that's because of something which they see in the movies, or some wrong belief that they have, that inhalers are the last treatment that should be taken in these diseases, and they don't want to start it early. Secondly, they feel that it's addicting. If they take an inhaler, then they'll get addicted to it, they'll never be able to get off it. And thirdly, they feel that they are very conscious of it. It's easier to take or swallow a tablet.
There are 3 or 4 common fears more. One is the word asthma. The word asthma scares people. And I think that's where we need to work on. We need to just reassure them that don't get scared of a word. Understand your condition and you can call it what you want as long as you understand what's going on. The word diabetes scares people. So it applies to any disease sometimes which gets a lot of attention in the media.